My name is Ron Lewis. I'm one of the robotic hernia surgeons here at Northeast Georgia Medical Center. I'm one of the directors for the Hernia Center, which is one of our centers of excellence that we have. And I also have a side job as the medical director for perioperative services for the system. I'm seated here with Dr. Chad Copper, and I'm going to let him take the opportunity to introduce himself.
I'm Chad Copper. I'm a general robotic surgeon here at Northeast Georgia Medical Center, and I am the other co-director of our hernia center at NGMC. Just to kick it off, kind of give us a history of Northeast Georgia's robotic service line, how we started, where we came from, just kind of give us a little overview.
So the robotic platform actually started right around 2008 with an anonymous donation of a robot to the Lanier Park campus. As we acquired Lanier Park as a system, we were able to move that system over to the Gainesville campus, and it was actually purchased to do robotic heart surgery, or donated to do robotic heart surgery, which, as everybody is probably aware, we did not do robotic heart surgery until 2023. So during that time, we were able to develop many other service lines. Again, starting in 2008, we opened the North Patient Tower in 2009. We transitioned over to an SI, which was one of the first advances, and then we transitioned over to an XI in 2015, I believe. And since that time, we have now added for a total of 7 robots here on the Gainesville campus and 2 robots on the Brazelton campus. So quite a bit of growth over that time, growth in the number of surgeons, growth in the number of service lines, and again, we did add robotic heart surgery finally in 2023. And that's kind of where we are now.
So tell us how many, over those years, how many patients have had robotic surgery here at Northeast Georgia?
So that is one of the milestones that we're fixing to meet is 25,000 patients, and I expect sometime in late August or early September that we will meet that. That's that is quite a big deal, and there are very few programs around the country that can boast that sort of numbers. To put it in perspective, the entirety of the Ohio State system is somewhere around 30,000 cases, but they have probably double the number of robots that we do. For us to be able to do that is a testament to the program that's been created, to the staff that we have, to the commitment of the surgeons that we have, to be able to make it an efficient platform. As you know, and you talk about this all the time when we do some of our total program observations, it's costs too much and it's too slow. That's always the mantra that we hear. Mm-hmm. So to be able to treat that number of patients, I think we've really been able to address that efficiency problem, and to make sure that we can do, I can do 6 gallbladders in a day, whether it's the robotic platform or a laparoscopic platform. So
I think from my perspective, it's actually been pretty amazing to watch the growth of this pretty cutting-edge type surgical platform grow so quickly and get the support of the OR, of our staff, of our C-suite, of the entire hospital system, and to grow it in a community system. I mean, yes, we're now a tertiary medical center. We have level 1 trauma, we have residents and stuff, but that's only been in the last couple of years.
Right.
I mean, we've had robotics, like you said, since 2008. And so for a community program to grow and have numbers comparable to the largest university programs around the country is pretty amazing.
Oh, it is. Speaking of cutting edge technology, do you want to talk a little bit about the DV5? Tell us what it is and how it compares to the old systems and what we expect to get out of it.
Yeah, well, let me take the opportunity to kind of back up a little bit for everybody. And just talk about where robotics came from. So robotics in surgery started really back in the late 80s when they started thinking about this stuff. I think the first robotic gallbladder was done sometime in the early 90s. And then two companies actually came together as one in early 2000 or so to form Intuitive Surgical, who is the #1 robotic company in the market today. There are a couple other smaller ones. Vicarious is one. What's another one? The Hugo robot is one.
J&J has one. Medtronic. Then they've got the platform in India.
Right.
SSI, I think.
So there's some other ones out there, but the vast majority of robotic systems in the United States are Intuitive Surgical's Da Vinci robot. So the original idea for that actually came from the military when they knew what it took to train a surgeon in the military to take care of wounded soldiers. And to put a surgeon at the front lines and have that risk of life, if they lost that surgeon, that was a large time commitment and cost to, quote unquote, make another surgeon. If they were able to put a robot out there with a surgeon away from the front lines to be able to operate on somebody, that would be ideal. So that's where that was the big idea. It never truly came to fruition because laparoscopic surgery, minimally invasive surgery, the robot wasn't really great for trauma, and they figured out that you really kind of need somebody there at the bedside to operate on them. Yeah. So you still got to have a surgeon. But when we took that into the private world, they really started to find some traction. The first time I saw a robot was in 2003, and that was when I was in residency, and they had it there looking at cardiac surgery. And this was that S robot, that was the very first robot. And it looks like a archaic, Atari gaming system compared to what we now use, which is the DV5. But then, really urology was the first ones to show a true advantage for the robot in prostatectomies, and that put the Da Vinci robot on the map. And then it started growing from there. GYN, really general surgeons like us were some of the last ones to the table. Right. And so, you and I started 2013, 2014 as the first general surgeons, but that was pretty late. So as you were talking about that, we started with the S, which was a very archaic system that now when we look back at it, at the time it was amazing cutting edge stuff.
Right.
But they have continued to grow and innovate, and so the DV5 robot is the one that we just got in June, and it is it's the latest, greatest 5th generation robot out there. So a couple of the things that we like about robotics. It's number one, it's 3D vision. So all of us know what it's like to watch TV, and it's a 2D vision, so 2 dimensions, but you don't have that depth perception, right? And so that's how we've operated laparoscopically for years. So the robot actually has 2 cameras inside, so it gives us that 3D vision. Now we have depth perception. So that just in itself makes surgery safer. Being able to see structures, being able to dissect around structures, especially when you're working on very small, minute areas. Number 2, it takes that little intention trimmer that everybody has. If anybody's ever tried to even hold a pencil out at a straight line and see if you can keep that tip from moving, it's always going to move just that little bit. But the robot, not a bit. So, in things like, even as something like a gallbladder where we're dissecting around the common duct, or you take it to something like cardiac surgery where they're, working on the vessels around the heart, you talk about something extremely minute and fine, to be able to have that kind of fine control is almost superhuman. It's really better than what we can do with our own hands. And so that's what the whole point of the robot is. I always say it's kind of a bad name for it, because when you hear robot, you think of,
I'm going to press a button. I'm going to put in inguinal hernia, and it's going to start and finish.
And kick back and go, all right,
exactly.
let me know when you're done.
How do I submit the bill for this? So,
That's right.
But that's not the way that it is at all.
Right.
And it should be considered as a laparoscopic tool. It's a great tool, but it is nonetheless a laparoscopic tool that has wristed instruments. And so I think that's one of the things that with the new edition of the DV5 that we are going to be able to push what we can do minimally invasive with that new technology. Yeah. Talk about some of the things that the DV5 brings to the table that maybe we didn't have in the previous version, which was the XI.
Yeah. So the XI was kind of the general surgery robot is how, not that we were biased or anything by saying that at all.
No, of course not.
But that's what we called it. Because it allowed us to operate in multiple quadrants of the body. We can move around. It gave us so much more range of motion and freedom, and really worked for so many of our surgeries. Both general surgery, colorectal surgery, all of that. So what DV5 has done is they've kept all of that stuff with the robot at the table, and all of those advantages, but it increased the computing power by 10,000 times.
Yeah.
I mean, just ridiculous. So the amount of data, I mean, we've only been using this for a month now, but the amount of data that we can get from the surgeries that we're doing is amazing. So that's the thing that we geek out about is, looking at, it'll show us what your hand motions are. It'll show us how much force we're using with each of those instruments. And at some point, we're going to be able to say, hey, this is the optimal force that you should use when tying a knot. This is the optimal force that should be used when doing a bowel anastomosis, when we're putting intestines back together. Right. And that's the best force for healing. And these things that we learn as surgeons over years and years of experience, but to be able to put them in an objective number sense, and maybe even on the screen, you're tying the knot and it gives you a yellow, 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 green. You're in the green area. Here you go. It's perfect.
Right.
Oh, red. You're too tight. Right. You got to back off. That kind of thing.
Well, I think being able to link data with patient outcomes is what is so exciting to us right now, and then to be able to transition from that data and the outcome that we know that it brings and wrap that into training the next generation of surgeons.
Absolutely.
That's really where we hope that the DV5 will take us as an organization, because if I can tell somebody, okay, your hands are too far apart when you do this, and we have data that shows that they're too far apart compared to an experienced surgeon, or just like you were saying, you're pulling too hard, you're not pulling hard enough, or there's that green zone in between of get right here and you'll be fine. I think the ability to do that is going to be a great thing for not only training the next generation, but just for patient outcomes within our community. I mean, that's what really this is all about, is just making sure that we have high quality patient outcomes for the people that we serve.
And all of us are trying to get better. I mean, there will be a huge opportunity for residents and new surgeons, but shoot, for you and I mean, I want to get better at what I'm doing,
right,
as I go through the second half of my career here. And so it'll be the very first time we've ever given objective instructions to experienced surgeons. Right. We do a lot of, we're required to do CME and read journal articles and get our recertification every 5 years, 10 years, whatever it is, and do those things intellectually, but we've never concentrated on, are you still real good at tying knots? Right. Are you good at sewing? Right. And now we're going to have some objective data to be able to tell people, hey, in this case right here, you did really well, except in this part of the operation. And with the AI stuff that comes along with this DV5, it can point out, you struggled in this part of the operation, and we would suggest you do these 2 modules on the simulator to improve your skills for these specific things.
You talked a little bit about, data and improvement, self-improvement, but talk a little bit about what the hub is and what your vision is for coaching and mentoring. I mean, it's cliche to say, but Tiger Woods has a coach. And I've always thought I would love somebody to be able to look at what I'm doing and say, did a great job. But again, in that one portion of the case, I noticed that you were holding yourself in a different way and your hands were out of the green zone. Talk a little bit about where you have that vision for the hub.
So the hub is the digital media platform that is included with the robot. Okay, so all of the information that's collected from the camera, all of the information that's collected from the hand movements and the movements of the arms, all filter through the hub. In this most simplest form, it's a TV screen. It just shows what's going on inside. So one of the things that we use it for is something called remote case observations, where we are helping to teach other surgeons around the country and actually around the world. We've had a really good relationship with some surgeons in India that they remote in, they're watching the surgery, and they're just seeing what's inside the body. So that's, but being able to learn from what we're doing. You and I we do this with each other all the time. We operate on the same day, and I got something that I'm like, either this is really cool, or I don't exactly know. Like, have Lewis stick his head in here.
Right.
And you'll just walk next door, and 98% of the time, you say exactly what I would have said, and I just go on. 2% of the time, I go, oh, dude, that's a good idea.
Yeah.
Yeah, think about that.
Right.
And so,
and sometimes, I mean, you really do. You can get tunnel vision. I mean, you can start thinking it's one thing, and you have a fresh pair of eyes come in the room, and they go, why don't you back up a little bit and look to the right? And you go, oh, okay, all right.
That's exactly right. So we've done that for years,
right.
And surgeons do that in all specialties. And really, especially here at Northeast Georgia, great collegial environment. I mean, it doesn't matter what group you're in, who you are, everybody helps. So that's awesome. But with DV5 and the hub, it's now, you don't just have access to who happens to be next door. You have access to really anyone. So what we did was, there was one of the tax surgeons was here doing an appendectomy, and he's starting out, in his robotics journey. So he asked me to log in. So I'm at home. He starts his surgery. He texts me and says, hey, can you check this out? I log into the hub from my office at home, and I'm watching his surgery. I'm able to use a pointer and go, hey, here, watch out for this. You might want to retract this way, kind of pointing in how I'm telling, and just give some little bitty tips and tricks, that, could he have completed that surgery by himself? Absolutely. He's a great surgeon. However, maybe, me being there, maybe we knocked off 10, 15 minutes of the case. Maybe we kept him from converting it to an open procedure, which in one of the cases we might have,
Right.
and he may have been able to stay with little bitty incisions instead of making a big incision, and that changes a patient's course.
Right.
So, so being able to mentor other surgeons is a huge opportunity for us.
Right.
And I think that if we're able to make that available and easy, and just as easy as somebody's walking past your door and you go,
hey, grab him.
Can you stick your head in here for a sec?
Right.
And that's all we're doing.